Hello, my name is Sheila Molony. I'm a professor of nursing and a gerontological nurse practitioner at Quinnipiac University, and I'm here today as part of the Aging Mastery Program to speak about medications and medication management. Medications can be extremely helpful when they're taken correctly and when they're taken based on the advice of a healthcare professional, but they also can pose risks, and especially as we age, if we begin to take more and more and more medications. Each medication that we add may increase the risk for a problem. And so to manage medications means that we take the medications that we need that will help us to live our best life. We take them when we should take them. We take them for the right reasons and in the right way. At least once a year, get a checkup. And I recommend that people put every single medicine they take in a brown paper bag and bring it with them to their healthcare provider. And that includes over-the-counter medications, maybe not something that you take with a prescription, but something that you buy for yourself from the drugstore, or herbals or supplements. Put those in the brown paper bag too if you use them on a regular basis. Another very important time to have someone do a checkup of medications is if you've been in the hospital, if you've had a health problem, and suddenly many new medications were added, or some of your medications were changed. That's a good time to be in touch with your healthcare professional and make sure that you're taking only what you need for as long as you need. Sometimes medications are started in the hospital and they're kept on board when they're really not needed for the long term because someone forgot to discontinue them. Pharmacists are your best friend when it comes to medication management. They can do many things that will help you to take medications safely and to manage your medications safely. For example, if you have medications that are prescribed by your primary care physician or nurse practitioner, and you also have medications that are prescribed by specialists, your pharmacist will make sure that there aren't any dangerous drug interactions that might be occurring when you have different prescribers. It's helpful if you use one pharmacy so that the pharmacy can keep track of that. Two of the most important things about medication management are keeping a list of all of the medications that you take, keeping a record, and bringing that with you whenever you go for healthcare appointments, or even if you're going for physical therapy or occupational therapy or other types of healthcare appointments. Because medications affect so many aspects of health and your ability to participate in some of those appointments. First, we want to ask what is the name of the medication, and we want to have someone write down for us both the brand name and the generic name, because sometimes individuals will end up getting a prescription for the same medication twice, once by the brand name and once by the generic name. When we get a prescription filled, it's important to read the label and make sure that it has our name on the label, that it is the correct medication that's being prescribed for us, and that we read the name of the medication on the label. It's important to ask, why do I need this medication? What's the reason that I'm taking this medication? And are there any alternatives to taking this medication? Are there risks and benefits that I should be aware of? How long will I need to take this medication? Will I need to be on this for the rest of my life, or is this a short-term medication? How will I know when the medication is working? And when can I expect it to start working? Some medications take 3 to 4 weeks before we notice a difference. So it's important that we don't get disappointed and give up on the medication too soon. Are there precautions that I should take when I take this medication? For example, is it okay to drive when I'm taking this medication? Is this a medication that should not be combined with alcohol? Finally, will this medication interact with anything else that I'm taking? That's an important question to ask. And again, that might include food. Some of us like to drink grapefruit juice, for example, and grapefruit juice can interact with many different medications. So it's important to talk to our healthcare provider about that. Whenever you start a new medication, that's an important time to take stock of what's going on in your body and with your health. If you have a change in sleep or appetite or new symptoms of any type, it's important to talk to your healthcare provider because it's possible that that may be related to the new medication. The medication interacts with your body in a somewhat unique way. And so it's important to talk to your healthcare provider about that. There may need to be some adjustments made. Polypharmacy is a funny long word. Poly meaning many and pharmacy meaning medications. And many of us need to take more than one medication. But sometimes polypharmacy happens because of something called a medication cascade. We will be taking medications for a health condition. The medication may cause a side effect, and a prescriber may prescribe another medication to deal with the side effect of the first medication. You can almost imagine a waterfall or a medication cascade. So that's a reason why we should ask our healthcare professionals and pharmacists to review our medication list periodically and make sure that everything that's on there is something that we absolutely need. It's very important to plan when you travel and maybe to ask your healthcare provider to provide an extra dose or extra set of doses so that you can have them just in case something gets lost in travel. You want to make sure that you have your medications with you. You may not want to have them in the luggage, for example. You may want to have them in your carry-on. And if you keep a list of all of your medications, the dosages, and the name of your pharmacy at home, that's very important to keep with you so that if the medication needs to be refilled or if it's lost, you can plan for that and take care of that right away. When medication expires, it's important to dispose of it safely. And while we're talking about safety, I want to talk about medication storage for a moment as well. If you have children or grandchildren or pets in your home, you want to be careful about how you store your medication. There are some medications, and that includes patches that you might wear, that can be dangerous if they're disposed of improperly and a child touches them or a pregnant woman touches them or something of that nature. So the storage of medications is very important. When we discard medications, we shouldn't just flush them down the toilet because that's going to end up in our water supply. We want to talk to our pharmacists. Sometimes the pharmacies have medication disposal days where if you have extras or old medication, you can bring them back and dispose of them there. Sometimes the town or community center will have a place like that, or the local police department or drug enforcement agency has a drug take-back day. And that's particularly true for higher risk medications such as opioids or pain medications, for example. Opioids are a class of pain relief medications that can be very useful for acute pain, post-operative pain, or serious life-threatening pain related to cancer, for example. However, opioids have been overprescribed, as you may have heard, and that's true for both younger adults and older adults. There have been stories of prescribing a month's worth of opioid or narcotic pain relievers for otherwise short-term conditions. And that can be very dangerous, both for young and older adults, because opioids can be addictive. are very addictive in some circumstances, and also because they can increase the risk for falls, for trouble with breathing, especially if you already have any type of breathing conditions, and they can cause other health problems in addition to addiction. So asking some of those questions that we mentioned earlier, such as, are there alternatives to this medication? Is there something else that I can do instead of this medication? What are the risks of this medication? And what are the benefits? That's extremely important. There are many non-opioid methods for relieving pain that might be safer in the long run if we are treating something other than cancer pain, for example. Well, let me tell you the story about Mrs. D. So Mrs. D was losing weight at a severe rate, and she ended up being almost around 90 pounds. And this was unintentional weight loss. And, you know, her healthcare provider ruled out cancer, ruled out diabetes, ruled out thyroid difficulties. And it turned out that most of this difficulty, most of this problem was related to her medications. They were causing reduced appetite. She was taking multiple calcium tablets in the morning in addition to all of her other prescribed meds, so that she had no appetite for breakfast or lunch at all. Her stomach was too full of medications. So by adjusting the timing of those medications and adjusting some of the dosages and forms of those medications, that problem fortunately was solved. Another example would be cimetidine or Tagamet. That's an over-the-counter medication that people take for heartburn. And I have had patients that I have seen who have thought that they had dementia because they were having trouble with memory and thinking when they were in fact having side effects from taking some of that medication. So that's a very important story as well. I hope that this information about medications and medication management was helpful to you. While medications play an important role in keeping us healthy, they need to be treated with respect so that as we take them, we continue to live healthy lives. Thank you so much and have a good day.